My name is Melissa Faulkner. I'm the VP of Marketing here at the Foundation. We are the Digital Health Hub Foundation, a digital health accelerator at the Worldwide Center for Healthcare Innovation. Our largest program is our awards program, which seeks to find the next best, most impactful and disruptive companies in 13 different categories. We had over 1,500 companies apply this year. 350 were named as quarterfinalists, and now we have our 127 finalist companies. We are here today with our 4 best in class and 8 rising star companies in the mental and behavioral health category. I would now like to introduce Mark Goldstein, one of our co-executive producers, our chairman and a partner at Builders VC.
Thanks, Melissa. And today there's actually 2 of us. I'm one of the executive producers of the show, Mark Goldstein. I'm a venture capitalist by day and a volunteer for the Digital Health Foundation by night. And with me is Matthew Holt, also one of our executive producers for the show. And there he is on the upper left. Most of you probably know him well. Really excited to have this webinar today. Mental behavioral health has been one of the historically the most applied to award categories of our 13. And once again, this year, you did not disappoint. We have a bunch of amazing companies, and we're going to go through this. Now, today, this is the raw feed. We're going to be editing this, and the objective of today for all the, for you companies is we're going to basically be taking what we think are basically those little slices of today and putting it into a feed that all of our judges will be able to see. The judges will use this. This is going to really help them in their voting, and this is one of the reasons we do this. In addition, we use this as a little more, giving us some more content that we can pull out and use for our grand finale show. So, with that, again, if you say something that you might not mean to say, it's probably going to be deleted. Don't worry about it. Mm-hmm. But what's really neat about today is I'm noticing is our best of class companies, and these are the companies that are historically mature. They basically have product in market. They have revenues. A lot of these were actually our rising stars last year. And so it's a good sign. That sort of shows that this is what we're trying to do. And we're basically trying to help companies scale and grow. That's our job as a nonprofit organization. And, we want everyone to win their digital healthy. That's our version of our Oscars. So what are we going to do today? We'll spend an hour at most. We're going to basically break today down into two pieces. We're going to start with our rising stars, and our rising stars will basically go through. We'll have to ask them two questions each, and those are 8 companies, of which 3 of them will end up being rising star winners at our grand finale. And then we're going to go to our best in class, and there are 4 companies, and one of those finalists will basically win at the grand finale in Las Vegas next year. Now, to frame all this, what we've done this year, and it's been really, really helpful, is we've been working with McKinsey and Company. So McKinsey has basically helped us think about how do we basically award great companies. We want to award great companies, not just great ideas. And McKinsey has a whole framework that they're going to go through now, which says, what makes a great healthcare company? This is what they do. This is the consulting they provide for a lot of not only startups, but a lot of, Fortune 50s. And really, really with that, I'm going to basically hand it over to McKinsey to establish some of the framework for today. Kana, it's all you.
Thank you so much, Mark. It's really exciting to be here today as a knowledge partner to you all. I'm Kana Enomoto. I lead our client work on behavioral health within our healthcare practice, and that includes doing work with and innovative collaborations with startups, with investors, and with longstanding clients that are interested in building new businesses. And so while many of you may think of us as a strategy company, we also do make longer term invested partnerships because we find it exciting to help new ideas get off the ground and reach more people. So over the past 5 years, our healthcare practice has served hundreds of healthcare service startups, portcos, and many multi-year partnerships where we jointly pursue growth, margin, revenue goals. In working with CEOs and investors, we've learned again and again that the 10 timeless tests of strategy can serve as a helpful mechanism to test the strength of their ideas and approaches. And we've highlighted here 6 of these strategies as of 10 tests for judges to consider. The first, pretty obvious. Will it beat the market? Is it comprehensive? And then the remainder, they break down the elements of a market beating strategy. So to give you a flavor, the first test aims to identify how your strategy is different and better to avoid the pitfall of just playing along with market forces. The second is around scarce resources. Too often, we're seeing companies and strategies that are unclear about the specific special capability that is critical to a company's success, right? Like everybody wants to do something in mental health. It's an exciting space. But what is it that makes this idea special and necessary? The question forces the discussion around what is your special sauce, right? Is it a privileged set of assets like a patent that can be bought or sold? Is it a distinctive competency which cannot be easily traded, like speed to product launch, but then that also confers a competitive advantage? So as you evaluate strategies, we'd encourage you to ask yourselves, like, how many tests does this strategy pass? So with that, I wish good luck to all the CEOs. Grateful for your passion, your dedication. It warms my heart to hear that the mental health domain or the behavioral health domain was one of the most popular. It is a space that I've dedicated my career to, and I'm so excited to see so many of you engaged here. So I'll hand it over to the champion and executive producer. With that, I wish everyone luck.
Great. Kana, it's great. It's also great being called a champion. Well, look, that's what we have here. We've got 12 companies that really all are. So we're going to start with the rising stars. So we have eight companies, and here's really how a lot of this works, guys. I have a question. I really want you to keep your responses to. I'm going to have 2 sets of questions to 30 seconds. Make it tight, and really think about. The first question is going to be around why, what it is you're doing, what is your must-have, why if you're a provider, why if you're a payer, why are one of your customers look at you as a must-have solution and not a nice-to-have, and how are you a part of their critical workflow? So I'm going to go through, and the first up is going to be Rooted. So tell me, let's see what you got.
Awesome, thanks. So with Rooted, we are panic attack and anxiety relief right in your pocket. And the reason why we're a must-have and not a nice-to-have is because while there are certain tools that can support with anxiety and focus that will help you reduce stress throughout the day, Rooted's really there if you have that debilitating panic or anxiety disorder. So rather than help you focus more throughout the day, we're actually going to help you get to work in the first place. And we have a history of reducing costs for healthcare providers and being there for members and reducing costs associated with panic attack and anxiety disorder.
I think that was an amazing 30 seconds. Up, Maro, you guys are next.
Awesome, thanks. So we are a must-have and not a nice-to-have because we know that half of mental illness begins before a child turns 14. Yet there is actually an 11-year gap on average from the first time that child shows a symptom that they're struggling with their mental health to the first time they receive any form of treatment or intervention. So what we've built at Maro, we consider a digital medical neighborhood, which operates across home, school, and clinic to support early intervention and risk detection. And we do that starting with school-based mental health screening and with triaged interventions. So our mission is to eliminate that 11-year gap between first symptom and first intervention when it comes to youth mental health.
Fantastic. Flow Neuroscience.
I'm Erin Lee, CEO of Flow Neuroscience, where we use electrical brain stimulation to deliver drug-free treatment for depression. Drug-free treatment is an unmet need, right? A systematic review of 34 studies shows that over 80% of patients would prefer a drug-free treatment option for depression. But today, 80% of folks receive drugs. Those drugs are ineffective. They work for less than 1/3 of people, and they have high side effects. Flow is twice as effective. It works 4 times as fast and has none of the side effects of drugs. We're a must-have because we're the first effective, affordable, and accessible frontline treatment for depression that can go head-to-head with drugs and delivers better patient outcomes. Thank you.
Great. Ellipsis Health.
Thanks, Mark. You can't manage what you can't measure. And up until now, there really hasn't been a scalable, objective, and personalized way to measure clinical depression and anxiety. And we've created a vital sign for behavioral health using voice analysis. We analyze both the semantic and acoustic aspects of speech to within 1 minute to be able to assess the severity of symptoms. This is obviously important because right now, what is most commonly used is a paper or digital survey, which is called patient-reported outcome, and those obviously are fraught with prejudices and biases to different patients. So we create something that is essentially the glucometer for mental health.
Fantastic. Thanks, Michael. Mobio Interactive.
Yeah, my name is Jon Brilliant. I'm the CFO of Mobio. We too play in this AI-powered digital platform to objectively quantify mental well-being. We have a different approach to Ellipsis. We do it through a 30-second selfie. We've trained our platform with 3.5 million digital biomarkers across 25,000 people in 170 different countries. Our platform has been clinically validated, both in terms of its measure of stress and mental well-being, as well as outcomes. Thank you.
And you have an unfair advantage for having the absolute best last name for anyone in the health business.
Thank you.
That's we have to discount that. You lose 2 points. ManagingLife. You guys are next.
We've all read the headlines about the opioid crisis. Thousands die every week. But what's not really talked about in these headlines is the fact that most people start an opioid because of an unmanaged pain problem. And 70% of people who have chronic pain also live with anxiety and depression. However, the vast majority will never receive pain psychology as part of their treatment. My name is Tahir, Janmohamed. I'm the founder and CEO of ManagingLife, and we use best practices in pain psychology to help people living with chronic pain better self-manage their condition and access the care that they need. What makes us an absolute must-have is we are the world's first and only digital solution for chronic pain that has been clinically validated to improve mental health outcomes. Thank you.
Excellent. Thank you. Thank you, Tahir. Scalable Care.
Hi, thank you, Mark. My name is Alan Billings. I'm CEO of Scalable Care, and we are a digital care platform that helps organizations scale the delivery of mental health services. One of the fundamental challenges to mental health care delivery and the crisis of mental health is a lack of resources and a lack of professionals to deliver that care. We solve that problem by giving professionals and organizations a way that they can scale resources by leveraging conversational AI and behavioral science combined with evidence-based mental health interventions that are developed by leading researchers. Thank you.
Great. BeMe. That's what
Hi, Mark. So happy to be here and to bring Matthew along. Delighted. So really fast, Nicki Tessler, pleasure to be with everyone today, CEO and co-founder of BeMe. We are revolutionizing the teen mental health space by engaging technology combined with human touch. You ask me what's a must-have. There's two things to say about that. This is a digital native population. So digital dominant realities just don't jive or resonate with the traditional archaic way in which mental health care delivery has been used and delivered today. And second is that you have to give teens what they like and need. You can have the best in breed clinical rigor, but if you don't also give them what they like, you will not engage and therefore not be able to impact. When you ask me how are we a must-have, I'm just going to leave it at 2 data points. We've only been a company for 2 years. We launched our product in January of 22, and in that year and a half, I've seen year-over-year growth with partnerships of 300% and in teen enterprise membership, 43,943% year-over-year growth. So I think the data speaks for itself. Thank you.
Oh, that's excellent. Okay, you guys are doing a much better job than in the other panels in terms of listening, keeping it to 30 seconds, and keeping it really tight. Now, I'm going to mention something that's really interesting. So we had 300 companies apply for both of you in this category across Rising Star and Best of Class. That's a lot of companies. Now, I know why you guys are all here, because you actually are doing something really different and unique. And, you know, a lot of companies are just offering traditional workflow, right? And, you know, call it a SaaS platform to sort of manage this stuff. And I think mental behavioral health category, it's evolving. It's getting to the next level where people are looking for very specific, great solutions to solve various, you know, more specific problems. You guys, obviously resonated with the judges. So I congratulate you on that, but I'm going to get to the second question, and we're going to go reverse order. So Nicki, you're going to get to go first now. So get ready. This is a little different question. I'm going to make it a little harder. You now know the other 7 companies that are up there. And if imagine that I'm a provider or I'm a payer, why do I can only deploy maybe 1, maybe 2 mental health solutions a year? It's too hard for me to basically bring these into our workflow. It's too hard for me to sell my, my executive team. Let's just assume that. Why do I select you first or second? Why is the problem that you're solving that one of those first problems that I need to sort of jump on today, assuming that I really don't have an arsenal of technologies available to me? All right, Nicki, it's all you.
Thank you, Mark. So pick us because there's no investment more worthy than the generation that goes after us. And what we know about Gen Alpha is they're more Gen Z than Gen Z. And so if you can't get behind investing in the future, I don't know what you get behind. And the second thing I would say is that when you think about teens, the current way in which, and it's been the lifelong love of mine, mental health, but the industry and the way in which it's set up as a paradigm simply doesn't resonate. So unless or until we evolve and advance, we are failing the next generation. And as a parent of 2 teenage daughters, there's nothing more important to me than what we give to the next generations to come. And you better believe it, the digital natives are here to stay. So thanks, Mark.
Okay. Scalable care.
Yes, thank you, Mark. There are really 2 reasons why you should select us as the solution. The first one is our digital care platform is a partnership with the UCSF Department of Neurosciences. And we have partnered with UCSF to create and deliver a very broad library of mental health tools and interventions that can extend and enhance the services that care providers give today comprehensively across the entire set of patient base or patient population. The second reason why this is the right solution is it's designed to fit in with existing workflows and provide tools for the providers themselves so that they can more efficiently and more effectively deliver better care to more people.
Okay, so better workflows.
Better workflows, more comprehensive solution.
Okay, great. ManagingLife. Why you?
Right now, chronic pain is something that is severely undertreated, and addressing the mental health comorbidities associated with chronic pain is an important reason for preventing readmissions after surgery, preventing opioid use and abuse, preventing chronic post-surgical pain. However, it is very challenging to have pain psychologists complement the traditional forms of chronic pain management, which are injections, medications, surgery. And so we use best-in-class, best practices in pain psychology to offer a self-management tool that can be used alongside what you're already doing in chronic pain to improve the efficacy in those treatments and workflows.
Great. Mobio, why you first?
Today, we spend trillions of dollars on mental health, and yet we haven't solved the problem. And one of the reasons we haven't, we don't have any objective measure of mental health well-being or stress. As the first solution to provide this, we believe that as a payer, you can develop an ROI calculation on the interventions. And if those interventions aren't working, our platform allows you to personalize those interventions. We know that mental health spans every chronic condition that there is. We know that stress causes inflammation, which is problems with diabetes, COPD, et cetera. And therefore, we offer you the first objective measurement of the interventions that you're otherwise paying for today, but you're not able to measure, and you can't manage what you can't measure.
Okay, so objective measurement. All right, objective measurement, that's great. Ellipsis Health.
I was on mute, sorry. What's great, thanks, Mark. What's great is that we can actually complement almost every company here. We provide the first objective, scalable, personalized, and validated measure of clinical depression and anxiety. We are the most published company in this space. We have more than 9 papers, a chapter in a book on our technology. And this can be used in any of these different companies here to help objectively measure how effective they are. Obviously, that's really important because you need to understand when you want to stop when people are getting better, so that you can then take the rare resources of mental health providers and triage effectively. And so by being able to understand exactly how their anxiety and depression are doing, you'll be able to use those resources in the best way possible.
Okay, so it's again measurement, ability to measure and find the best, the worst, and who needs help right now. Flow Neuroscience.
Yeah. So Flow's digital platform is beneficial for patients, providers, and payers, right? Payers are going to love us because we save them money, point blank, anywhere from $200 a month for your average low maintenance patient to over $2,000 a month in cost savings for postpartum and comorbid patients. That's from reduced side effects, drug interactions, et cetera. And look, it's surprising to folks, but clinicians are just as frustrated by the lack of effective treatment options as patients. This puts time back in their pocket. They're not managing drug interactions. They're not titrating on and off ineffective drugs. And the platform gives them the opportunity for revenue upside with remote monitoring of their patients.
Great. Maro.
So, and I didn't introduce myself last time, apologies. I'm Kenzie Butera Davis, the CEO and founder of Maro. So there are a lot of really incredible teletherapy and telepsychiatry solutions that are meeting kids and meeting families at the point of care. But what's missing is that we aren't catching mental illness early or really anywhere near the time of onset. So at Maro, our bread and butter is screening, it's risk detection, and early intervention in mass. We've built what we call the TurboTax for mental health care, which helps schools do what they're already doing with physical screenings, but for mental health in a compliant way and at scale. So we're catching the problem early and we're helping kids build skills before they're in crisis. We should win because employers, health plans, and families are spending $280 billion annually reacting to the mental health crisis. What we're doing is we're flipping this paradigm on its head with the only proactive and preventative solution that engages entire communities across home, school, and clinic.
Excellent, Kenzie, good job. Okay, Rooted, why you first?
We should be selected first because of our history of user adoption. So outside of our B2B partnerships with health insurers, we actually are available through the app stores. We've had over 2.7 million downloads, and 95% of those downloads are organic. And that means that users are using the app, feeling the benefits, sharing the results through user reviews. We have over 50,000 user reviews with a 4.8 out of 5 rating. And they are sharing how these immediate and preventative tools for anxiety and panic attack relief have really impacted their lives. So you should choose Rooted because we are rapidly proving our product market fit in a really safe, clinically assured way.
Fantastic. Hey, Matt, I'm going to hand it over to you. What are your thoughts of this group?
So I think it's it's a fascinating group, right? Because what you're seeing at is some of the areas that are really important in the future of mental health. So I think 3 of you are doing kids, and those of us who have young kids know how problematic that can be. And this generation is different, and also it has a lot more mental health issues, especially post-pandemic, than in my day it was a stiff upper lip and you get beaten if you do something wrong, and we have to change that approach. A couple of you doing chronic pain or tools to change drugs, I think, like a flow neuroscience, and then a couple more of you are doing new types of diagnosis. Because the PHQ-9, which, by the way, invented by a drug company to sell more drugs, it's not necessarily the solution for this. So really fascinating. But I think I was to put one thing that's going across this whole group, which is which is different from where we've been in mental health in the digital health landscape the last few years, is that everyone is really doing something that's scalable and automated in general. And that's what we've got to go to, because we know from the current situation of the current players in mental health and online, they've done a great job. But in general, they replaced what we used to do in person with doing it over a video call. And we know that we don't have enough therapists, and we know we don't have enough time, and patients need 24/7 care, not once every week, 2 weeks, whenever. So I think that's to me, that's the big change that's coming. I think everyone is the judges have done a good job in selecting people who are sort of pushing that ball in the right direction, hopefully downhill, and we need the rest of the healthcare system to join in.
That's awesome. I would absolutely echo that. I mean, we're sensing a sense of automation, and as opposed to doing to just the traditional augmentation. Guys, this is great. You have 8 amazing companies. 3 of you will get this. I always, right here, you're digital healthy. I always carry one around. So in Vegas, we'll see you all there. You're all real winners and being a Rising Star finalist. And please stay on if you can. We're now going to get to our 4 best of class companies, and from there we're going to get to the next group. So let's talk about best of class. So best of class, these are companies that have revenues that are validated, that have been in market, that can basically talk very specifically about data. There were 100 or so best of class companies that applied, and for whatever reason, the judges resonated to these 4 companies as finalists. They're all great companies. Some of these companies are bigger than some of the others, but they all have data to talk to. And I think what we're going to want to hear today is about really specifics, the data on how you're scaling and why you're a best of class company, and how you're basically, getting to, you've earned that right, and you're going to earn the award. So with that, we're going to do the same type of question though. We're going to do the same type of question, and we're going to start with, we'll start with Bicycle Health, and which is, again, let's go to the must-have. Why are you a must-have, and why are you part of the critical workflow of mental health for a payer and provider? Bicycle Health.
Thank you. Hi, I'm Amy Finney, and I'm Chief Operating Officer at Bicycle Health. Bicycle Health is the United States' largest virtual provider of integrated medical and behavioral health for opioid use disorder. And to date, we've helped over 31,000 patients in 32 states with an evidence-based care model. Drug overdose is the leading cause of death for working non-elderly Americans, and 70% of those deaths are opioid related. We believe nearly 10 million Americans are actually affected by opioid use disorder. So this is a huge, huge issue. We treat this better than anyone. We have best-in-class retention rates in program, and we do this at scale. We are in 32 states. We're able to get to people in rural populations who otherwise wouldn't have access to treatment. And we're able to care for people who would not be able to get care in other traditional modalities.
Fantastic. Ria Health, Tom, you go next.
Good morning, everybody. Thank you, Mark. I appreciate our peers at Bicycle Health, but I think opioids have been getting all the ink and all the attention, rightfully so, because of the problem. But what we've done is we've overlooked the size and magnitude of alcohol use disorder. And so why leading health plans choose Ria Health is primarily because of our total population approach to alcohol misuse. And so we're able to help at the beginning by providing early intervention, engagement that reduces the navigation issues people have when they're looking for help, helping people, self-care, self-change, instead of just going into clinically inappropriate settings, as well as providing an evidence-based comprehensive treatment program. When we look at our industry-leading data and outcomes as a center of excellence by focusing on alcohol use disorder as a singular approach, what we're able to do is really scale up the clinical quality and provide not only patient-reported outcomes, but combine the patient-reported outcomes with objective outcomes that come from our patients using a Bluetooth breathalyzer. So being able to marry those two results, then going deeper into the data to see how they're impacting their long-term healthcare utilization, the reduction in ED admissions, and then subsequently really filling some of the gaps that we see in performance today that's measured by certain HEDIS scores. So scoring exponentially higher than our industry peers on engagement, initiation. And so those are the things that really set us apart from some of our peers that are tackling substance use in general, but also by having that center of excellence approach, appealing to the people that are really struggling with alcohol misuse by really speaking directly to them.
And do you have give us some specific numbers, since this is best of class and we're talking about scale and number of patients you guys have touched?
Yeah, we've touched over 9,000 patients, and we've been able to see average reductions in the first 60 days of 50% in their alcohol consumption and about 75% over the course of a year. We've seen reductions in ED utilization, and we've also seen that people who are in our program are able to score higher on PHQ and GAD-7, so overall well-being and mental health. And we're working to solve some of the hardest problems, mainly around, I'll stop.
No,
Go ahead, Mark.
It's great. This is a topic we should be going on forever. But I'm going to hand it over to Brightside Health. So Brightside Health, tell me about why you're a must-have and part of the critical work.
All right. Well, first, so great to see everyone here. Just awesome to see so many great companies, and makes me really happy to be part of this dialogue. Suicide support is the ultimate must-have. It's literally life and death. And unfortunately, we now know that we've had a rapid rise in the suicide rate in the last 20 years. We have about 50,000 suicides per year in the US, but the best estimates also show that over 12 million people a year seriously consider suicide. So they're at the precipice of a catastrophic clinical event, as well as some of the most costly and ineffective treatment events being ED visits that have almost doubled in their proportion for mental health complaints in the past 10 years, and inpatient psychiatry. And so unfortunately, when somebody is escalating in their suicide risk, they end up becoming a hot potato. They need timely care, but they also need a very specific type of care. It's not routine mental health care to actually reduce somebody's risk of following through with suicidal ideation. It's specialized protocols. And so few providers have the training or the comfort level to actually deliver this type of care. And these patients end up not getting the type of care they need and ending up in these costly and ineffective settings. And unfortunately having these catastrophic events of death by suicide. Brightside has developed our crisis care program utilizing the CAMS care protocol, which has 30 years of evidence and 5 controlled trials behind it, so that our providers can quickly and effectively see and reduce suicide risk, as well as reduce ED and inpatient admissions and readmissions, helping our payer and provider partners achieve their clinical and financial goals.
And you do it at scale. Let's hear some numbers, because I know you got some good numbers.
We do it at scale. We've treated well over 100,000 patients. We've published 10 papers in peer review showing our methods and outcomes, including one paper in which 77% of those individuals presenting for care at Brightside, starting with suicidal ideation, no longer report any suicidal thoughts after 12 weeks of care, which is over 4.3 times higher than a control group.
Excellent. That's great. Okay, we're going to go over to Tiatros. Seth, tell us why.
Yes, hi, I'm Seth Norman. I'm Tiatros' Chief Innovation Officer. And I really believe that Tiatros is a must-have simply because we know it works. We have demonstrated clinically significant reductions in a variety of mental health problems. We've also done it for a variety of different demographic groups in a variety of different contexts. And most recently, we were included in a survey publication in the International Journal of Environmental Research and Public Health. This was funded by the Canadian government. They reviewed over 1,400 different solutions on the market, and Tiatros was one of only 4 digital behavioral health solutions that they thought really truly demonstrated clinical validity. And so we just simply believe that digital behavioral health tools need to be held to the same clinical standards of anything else that doctors would give to their patients. And we've taken the time to really demonstrate that in peer-reviewed journals and other publications.
And so when Tiatros, I want you to be detailed. Your must-have. What is your must-have feature that maybe your some of the other 3 companies don't have? What got all the judges to vote for you as a finalist?
That would be our use of combining social support with also individual skill-based training. We simply believe there's no mental health without community mental health. And so giving people a place to work for themselves and also with each other together is really what made us so successful.
Okay. All right, great. So we're going to move on to the second part of the questions here. And the second part are really allowing the 4 of you to really recognizing the other 3 companies that are in this best of class category. And we really, it's like, again, really, I want you to tease it out even more. Why are you different? And why does basically a judge want to select you first? And why does a judge want to select you? But why does a provider or a payer want to deploy you first if maybe they haven't, deployed a variety of other solutions yet? So I guess Seth, keeping with you get to go first because you went last.
So what makes Tiatros really special and different is this focus on supporting the relationships that are so important to mental health. And so we do things to support that all-important doctor-patient relationship, that therapeutic alliance. We also focus on the patient-peer relationship, the all-important role of the people you live and work with and how they can help you with your mental health and vice versa. And then, of course, the patient's relationship with the Tiatros platform and learning to turn to Tiatros, work with Tiatros as a lifelong partner in their own mental health. But by focusing on these relationships, we grade ourselves by the same rigorous standards for adherence and completion as used by some of our first partners at the Veterans Administration's hospitals. Depending on the hospital location, they expect only a 2 to a 7% completion rate for their cognitive behavioral therapy services. With Tiatros working with the same cohorts, we get anywhere from a 75 to a 90% completion rate. And we think that's because we put together a tool where all of those relationships can exist and work together.
So people are really using,
Yes.
Basic utility. So there's a lot of, that's always been a lot of the criticism in some of the behavioral health categories is that, while the tools were out there, they just weren't taken advantage of. So that's really
the spoonful of sugar makes the medicine go down problem. Tiatros is focused on how do we meet you, the individual patient. We know the CBT is going to help. How do we get you to take it? And that's where we highly personalize each delivery for each patient.
Excellent. Great. Okay. Brightside. Why you? This is an easy one for you. Why?
Listen, solving the magnitude and complexity of mental health problems that we have is going to require a lot of investments and a lot of working together. Fundamentally, helping to solve the challenges related to suicide risk and the associated clinical and financial impact is really step one. And that's because we are driving a significant portion of our cost in mental health through unnecessary and ineffective treatment settings, being the ED and in many cases inpatient psychiatry. This is both because of upstream and downstream challenges of those 2 settings. When people need care and can't find it, they end up in the ED. Only a small fraction of people who present at the ED with a mental health complaint end up needing inpatient psychiatry. The vast majority are discharged back to the community, often can't find care, and about 14% come back within 30 days. And very similar dynamics in inpatient care, driving this cycle of ineffective and expensive care that's been a long-standing and intractable problem for both payers and providers. And we know that EDs are getting clogged up, slowing down throughput, and driving substantial costs and poor clinical outcomes. By being able to treat in a more effective, timely, and cost-effective outpatient setting, we can reduce the burden on EDs, reduce the associated costs, as well as support quality measures that have been really intractable. 7 and 30-day follow-ups post-discharge and post-hospitalization have been extremely hard for these entities to perform against for many decades now. So we offer an alignment in the partnership between achieving better clinical outcomes and better financial outcomes with a near-term ROI for both payers and providers, filling a gap that's been persistent for decades.
Great, thank you. Tom, Ria Health.
Yeah, so I think why Ria Health is someone that people select is primarily because we built our foundation on the clinical quality of our comprehensive treatment program, which matches medication-assisted treatment with psychosocial support. And we have peer-reviewed evidence that supports the quality of those outcomes. But what we recognized in partnership with our health plans was that we still weren't solving the navigation issue. So they built out all these great networks pre-COVID, during COVID, and people were still going to Dr. Google to figure out what they should do if they were struggling with a stigmatized condition like alcohol use disorder. So that's really where we started to unlock opportunity, which is to have engagement that's non-stigmatizing, that's educational, and that leads people to better understandings around the in-network options and choices or the evidence-based levels of care that are appropriate for them. So by being able to do that on the early intervention side and combine it with a comprehensive program, we're now the total population solution, and that's why the health plan partners choose us.
Great, well done. Bicycle Health, why you? Let's talk about why you first.
Yeah, thank you. Like we touched on, OUD is a huge cause of death in the United States. About 100,000 Americans die every year. Millions more are impacted. And traditional OUD in-person treatment programs actually only serve about 10% of the target population today. And they're really designed around the most severely affected. They're constrained by their physical locations, hours of day, and other things like that. More than 85% of people with OUD are not in treatment. Additionally, our program is almost twice as effective as in-person treatment programs. We have an 80% retention rate for insured patients at the 90-day point, when the industry average is about 44%. And 2/3 of our patients are able to start treatment within 48 hours, and 95% feel stable on their medication within 7 days. This is so important because for people in opioid withdrawal, time to treatment and stabilization is critical. If you're not treated quickly, the likelihood of relapse is nearly 100%. So we quickly get patients into effective treatment regardless of where they are, and we keep them there better than really anyone else in the industry. And we're currently licensed in 32 states. We have 110 million covered lives, on track to be 200 million by the end of next year.
Excellent, that's great. So Matt, I'm going to turn it over to you. I know you got a few questions.
Yeah, I mean, so I'm going to ask the inverse of the other question that I asked about the rising stars. So the majority, and Seth, block your ears for this part, the majority of you have mostly been doing that sort of traditional telehealth, teletherapy, or other, have had humans in the loop and one-to-one meetings and group therapies. And then obviously you all have, and obviously Seth at Tiatros, you sort of start with this, but you do go the other place. You also have the automation part and the self-service part. So I just want you to all very quickly comment on where you are in the journey to sort of delivering the self-service automated part of this as well as the in-person part. And what's the right ratio? Maybe, I don't know, for Amy, for Bicycle, it doesn't work or what have you, but what do you think the right ratio that we're going to end up is between, the very expensive humans and hopefully the scalable technology? Where do you think we end up in your system in the next short term, not in 20 years, but what are you building product wise? So let's quickly go around. And I don't know if Seth, it may be a cheat to ask you. Why don't we start with Brad?
All right, yeah, the perennial question that we look at in this space, of course, Matthew, how do we address the shortage of mental health providers?
Sure.
Where Brightside focuses at the high ends of severity and acuity is not a part of the clinical continuum where I think fully automated tools are going to be sufficient or adequate to meet patient needs. That said, there's a massive opportunity to use technology to augment our providers. That is to get the most use out of their time and to help them make the right decisions at the right time for the right patient. So Brightside has built this into our platform. We have proprietary data-driven prescribing algorithms to make sure we get the right medication for the right person and get dramatically better results than traditional studies have shown for this drug class. as well as a responsive care model. So instead of the traditional calendar-based heuristics that most mental health care has operated on of try this and come back and see me in 6 weeks, we need to be able to monitor patients, see how they're doing day in and day out, and to be able to intervene and support them when they need it, not at the next appointment several weeks away. We also, Brightside and every other company in this industry needs to and is working hard, I'm sure, at automating and streamlining all of the administrative aspects of care so that you can get the most clinical time out of every provider. This includes things like AI note generation, supervision and quality assessment and processes on the back end, et cetera. Ultimately, the right care for most patients in mental health and at the high end of the severity and acuity spectrum in particular is comprehensive care. It's a mix in many cases of medication, of therapy, and of automated self-care tools and peer support that's ultimately going to deliver the most scalable and most impactful benefits.
Tom?
Yeah, hi, Matthew. Our focus is really on the quality of our care team and the passion that they have in serving our population, and not to necessarily replace that, but to make them, better at what they're doing, and using whether it's AI or other forms of automation that are going to, give them the opportunity to make those meaningful connections and provide the personalized care that leads to the best outcomes. In our early intervention product, it's structured in a way where when you're talking to a large group of people that may not have alcohol use disorder, but maybe binge drinking, you could provide them with really great education and understanding. And you could do that by using technology, using content that's meaningful. So we're focused on leveraging today's innovation in artificial intelligence, mainly on getting our providers to be less stressed and burnt out in what they do so that they can improve always the interactions that they're having with our patients. But we're not trying to replace what we do with humans with robots in the patient-to-patient, provider-to-patient interactions.
Pity, I've always wanted to be replaced by a robot. Amy?
Yeah, I think it's a great question. And we actually do leverage technology for part of our care journey for our patients. The first thing I want to call it is our buprenorphine induction tool. When patients are initially entering treatment, it's often a very stressful time for them and they have a lot of questions or might need to check in with a clinician. We actually have a self-service tool in our app that takes patients through the journey. They can understand their symptoms, and this tool actually helps people stabilize quickly without requiring more face-to-face time with clinicians. And it actually dramatically reduces their negative experience of moving from withdrawal into stabilization. We also have built something we call a pharmacy finder tool. This helps patients actually get their prescriptions filled. This is actually really important. 40% of pharmacies do not stock the medications we prescribe. So we built this tool to help patients get their prescriptions filled at the first pharmacy they went to and get them filled in the first day. 99% of our patients get their prescription filled on the first day. And with the importance of time to treatment, that again is important. This saves us a ton of time calling, coordinating care, redoing visits if a patient's unable to fill a prescription. And additionally, through our app, we actually validate and navigate urine drug screening. We have very, very low falsification rates, some of the lowest, and we've validated that in peer-reviewed journals. And so although we do not fully automate the care we give, our technology helps us get to more people faster and helps this really be far more scalable as we grow.
Yeah, it sounds like commonality of an answer. And as the parent of 2 kids, both on ADHD meds, you should just take that part of the company and sell it and give up the rest. That's much more important. It's probably a huge demand for finding out what drugs at what pharmacy is available is a massive problem, independent of all the stuff we do.
Echo that. Echo that.
Seth, this is a layup for you. So
yeah. Well, I'll echo where I agree with my peers here is indeed taking a lot of the workload off of those frontline caretakers. One of the interesting statistics that I keep in my back pocket, of course, is that 60% of the counties in the United States have no behavioral mental health specialist. But then also very interesting, 87% of all behavioral health prescriptions come from non-behavioral health doctors. And so building a tool that can spread across the horizontal axis of care and meeting any type of doctor and helping them serve their patients is essential. But where I differ, or where Tiatros differs, I should say, is our focus really on helping the patient self-actualize. using our tool to teach them to seek care through the platform. And so, if we could snap our fingers and suddenly have all the psychotherapists we needed in the world so that everyone on earth got a psychotherapist to follow them around 24 hours a day, that actually wouldn't be the answer. Therapists will tell you most of the hard work of psychotherapy happens outside of the doctor's office. It's about what the patient is doing with what they learn and applying it with their friends and at work and with their families. And so a tool that's using artificial intelligence to help guide patients, teach them to rely on their own skills that they've already learned in the platform, and not to be crude about it, simply turning to a tool like Tiatros instead of waking your doctor up at 2 a.m. for because you can't sleep or some other emergency. This is where we really see the long-term benefits of a tool that's automating some of these processes, helping patients get to the source of help that they need for themselves. That sort of self-actualized care is the real promise of digital behavioral health, I believe.
All right, great answers and interesting range. And yeah, it's got to be both, right?
Mark,
take it away.
Great. Well, good. We're 1 hour in, exactly where we wanted to be, and 4 great companies. Actually, you're all finalists. You're all basically winners. You're all going to be there. I'll see you all in Vegas, and one of you will get this. Or yes, I get to hold it up again. Get the digital healthy. You've done a great job. I think this will be really helpful for the judges. I appreciate your time. Again, we'll have an edited version for them, and now get back to the rest of your day, and see you in a week or two.
Thank you.
Thank you, everybody.
Thank you.
Bye all.
Hi, I'm Amy Finney, Chief Operating Officer of Bicycle Health, the largest telehealth provider of integrated medical and behavioral treatment for opioid use disorder, or OUD, in the United States. We offer an evidence-based care model that includes FDA-approved medication for opioid use disorder, access to a highly trained team of medical experts, therapy, a customized treatment plan, and peer support groups. Bicycle Health was created because we live in a country where 9.2 million Americans suffer from opioid use disorder, but many of them don't access treatment due to barriers like stigma of addiction, lack of qualified providers, insurance coverage, and more. Bicycle Health's mission is to address our country's #1 public health crisis by helping to reduce stigmas associated with opioid addiction and providing access to affordable, convenient, and confidential telemedicine addiction treatment for everyone who needs it. Our superpower is our research-based, patient-first approach, ensuring everyone has access to effective treatment for long-term recovery. Our personalized, outcomes-based platform and evidence-based care model was recently validated in a peer-reviewed study in leading medical journal BMJ Innovations. We aren't afraid to stand up for our patients, and we're the leading advocate for greater access to medications for opioid use disorder. Our latest research in the medical journal JAMA calls on pharmacies across the country to stock buprenorphine. This year, we have been bold in our stance against the proposed rulings from the DEA. We truly rely on research, evidence, and patient anecdotes to prove what the future of addiction treatment can and should look like. Bicycle Health is leading the fight against opioid addiction with a virtual, affordable, and effective care model that tackles access barriers while providing quality treatment in a way that puts patients' needs above all. Bicycle Health is saving lives.
Hello, I'm Brad Kittredge. I'm the co-founder and CEO at Brightside Health. Brightside is a national telepsychiatry platform serving the needs of individuals with the full range of mood and anxiety disorders. Brightside's a different kind of provider, and today I'll tell you about 2 ways that we're different. First, we turn the standard clinical convention of guess and check antidepressant prescribing into precision medicine. Under standard approaches, only about 35% of people respond to the first antidepressant that they're prescribed because we tend to think of depression as if it's just one thing. But by using Brightside's Precision RX tool, we account for the inherent heterogeneity and subsegments in this population, helping our providers select the right medication the first time, 68% of the time, almost doubling the clinical convention. Second, we focus on treating the hardest cases that others avoid. Over 12 million individuals seriously consider suicide every year in the US. These people need timely, effective care with specialized protocols. And unfortunately, few providers are comfortable treating this population or familiar with these protocols. These patients bounce around like a hot potato, ultimately ending up in the emergency department, inpatient psychiatry, or worse. Brightside fills this gap, offering timely, effective care to reduce suicide risk, all in a cost-effective outpatient setting. Patients with depression and anxiety need better care, and Brightside is delivering. You don't just have to take our word for it. We like to show our work. We've now published 10 papers in peer review showing our methods and outcomes. One such paper shows that of those presenting for care with suicidal ideation, 77% no longer reported any suicidal thoughts after 12 weeks of care with Brightside, and that was 4.3 times higher than a control group. Together with our payer partners and health system partners, we're saving lives and expanding into Medicare and Medicaid. Thank you.
I want to introduce you to Ria Health, a pioneering force in total population health solutions for alcohol misuse. At Ria Health, we aim to empower individuals to transform their relationship with alcohol. We achieve this through a comprehensive range of education, early intervention, and comprehensive treatment programs proven to reduce the risk of alcohol misuse. Alcohol misuse can affect people at all stages of life, and we understand that individuals require personalized support at every level of severity. Our expert medical team collaborates with our coaches to deliver a proven evidence-based tech-enabled experience via telehealth. Ria Health has become the leading national telehealth provider specializing in alcohol misuse treatment from our commitment to clinical quality and safety and the outcomes that our patients are achieving. Ria Health is the first alcohol treatment program to provide accessible patient care in all 50 states. It supports our national health plan serving multi-state employers by offering employees in all states an equitable treatment solution. Our health plan partners will say that our secret weapon is clinical quality combined with a mature clinical operational technology platform. The ability to report on detailed objective outcomes enable a secure and effective collaborative care models and maintain high patient engagement sets Ria Health apart from our peers. Ria Health excels at providing analysis of pre-claims population risks and has partnered with leading universities to conduct peer-reviewed research studies. Why award Ria Health? First, persistence. By delivering high-quality experiences for 6 years, impacting tens of thousands of people's lives, we've gained the trust of our partners and our patients in helping people change their relationship with alcohol. And then last, timing. This week, Kaiser Family Foundation reported that post-COVID increases in alcohol liver disease deaths have killed more Californians than car accidents and breast cancer. It's time.
Tiatros is designed for the new age of digitally enabled psychotherapy. It's a platform that grows with patients to deliver the best and latest therapies to treat their diagnosed mental illnesses, support the mental health and well-being of patients with chronic diseases and disabilities, and improves the psychological resilience and performance of diverse global workforces. Provides a lifetime of effective and affordable mental health, addiction and well-being services while connecting patients to crisis intervention services, social support, and other essential resources. What's Tiatros' superpower? Well, Tiatros dramatically increases the availability of effective and affordable mental health and addiction care services while reducing their cost and wait times. Tiatros helps behavioral health experts create holistic treatments that integrate scientifically proven behavioral health services into existing primary and specialty care clinic workflows. It enables provider systems, employers, and education systems to equitably meet the needs of large populations. And it encourages patients to form healing peer relationships with other patients who share and understand their experiences. And then these human connections become the always there ecosystem for access to immediate emotional support, informal role models, and the ongoing motivation necessary to make and sustain behavioral change. And because Tiatros' proprietary artificial intelligence is always learning more about how patients prefer to receive treatment and which techniques are most likely to help them heal, Tiatros helps practitioners strengthen the therapeutic alliance and turn every patient into a long-term Tiatros user. And why should we win? Well, Tiatros is uniquely positioned as the premier global platform for digitally enabled psychotherapy. It turns the $1 trillion global mental health and addiction crisis into new revenue streams for its customers and partners, enabling them to equitably deliver the next generation of effective and affordable mental health, addiction care, and well-being services for over 1 billion people worldwide who are waiting for help.
I'm Erin, Flow's CEO. We're facing an unprecedented mental health epidemic. By the end of the decade, depression is expected to be the leading cause of mortality globally, affecting 500 million people. Despite the prevalence, the leading treatments are terrible. Over 80% of people are prescribed drugs, even though they don't work and come with serious side effects for the majority of users. Flow is different. We've developed a revolutionary new way to treat depression that's effective, safe, and affordable. It starts with our headset, which leverages TDCS to deliver gentle current to the part of the brain responsible for regulating mood and emotion. Flow works by using this current to stimulate brain activity and reduce depressive symptoms. We combine our headset with a companion app and clinician portal to deliver a fully transparent, digitally enabled treatment solution. The Flow platform provides a holistic treatment for depression that's easy to use, safe, and effective. Effectiveness is our superpower. We just released the results of our pivotal clinical trial, which showed that over 90% of Flow users experienced a clinically significant improvement in symptoms, and 56% of Flow users were relieved of all depressive symptoms. Using Flow was shown to be completely safe with no major side effects. And best yet, Flow was shown to be nearly twice as effective as antidepressants. And we weren't better than just one or two. Flow outperformed all of the 21 best-selling antidepressants. Flow's effective treatment has already helped over 12,000 people across Europe. People like Ania, who came to Flow after years of trying everything else on the market. Drugs, therapy, even hospitalization. Nothing worked until Flow. We deserve to win so that we can help the millions of people like Ania who've been let down and left hopeless by traditional treatments. At Flow, we want to help people go from surviving with depression to thriving again.
My name is Kenzie Butera Davis. I'm the CEO and founder of Maro. And I'm here today to deliver a positive message because my team and I are building the future of student mental health. Now, last year, 220 children's hospitals produced a report. It said that 50% of all mental illness begins when someone is a child, so before the time that they turn 14 years old. But it takes 11 years on average to get from the first time that child shows a symptom that they might be struggling with their mental health to the first time they receive any form of intervention. And if you're an educator in this room, you know how that impacts the classroom. Now, there are many amazing teletherapy companies that are offering their services to kids, and we actually partner with most of them. But when you are reaching kids at the point of care, it's often too late. So Maro's technology sits at the intersection of schools, families, and providers to identify the problem early. We partner with school districts to facilitate mental health screening at scale, and that's something that many states are now starting to legally require. When we identify students who are at risk, we refer them to either virtual or local clinical support. From there, it's our mission to help districts get from reactive to proactive through wraparound services, including curriculum, professional development, and a family engagement app. This app enables school districts and families to partner throughout a student's mental health journey through in-app content, behavior tracking, and thanks to an exclusive partnership with Ria Health, Every family in Maro districts has access to text a pediatrician with any questions about their child's wellness.
My name is Janmohamed, and I'm the founder and CEO of ManagingLife. It's an honor to be considered for the UCSF Awards. At ManagingLife, we're tackling the chronic pain and opioid crisis head on. And it's a problem that affects employers across North America, as it's an extremely prevalent condition and a significant driver of both absenteeism and prescription drug use, such as opioids. Beyond that, it's also a leading cause of medical expenditures on health plan claims, as well as a leading cause for disability. Our solution, Manage My Pain, is a clinically validated digital solution that empowers people living with chronic pain and teaches them coping strategies. It starts off with our app, which is the top ranked and most downloaded pain app on the market. It's based on acceptance and commitment therapy principles. As people track and record their pain, we play back that information through charts and graphs to highlight patterns and trends. We also then share them educational content that teaches them coping strategies rooted in the best practices of pain psychology. That information is then translated into reports that they can then share with their care team. And finally, all this information can be seen remotely and digitally through our monitoring portal at the aggregate, at the population level, or down to the individual. Now, what makes our solution truly unique is that it works. In March of last year, the University Health Network announced a publication of our multi-site validation study that showed that our solution had resulted in improved outcomes, both from an anxiety and pain catastrophizing perspective. It makes ours the world's first and only digital solution with clinical validation. At RBC Insurance, people who used our solution on disability had a 7.5-month shorter claim duration.
Hi, UCSF judges. My name is Ania, and I am the founder of Rooted for Panic Attack and Anxiety Relief. I first started Rooted due to personal experience with anxiety and panic attacks. They were extremely debilitating for me. I was in my final year of university when I first experienced them, and I couldn't find any help that I needed to get better. I took to my phone to see if there's a solution that could help, and while there weren't any then, it did inspire me to create one that did. Fast forward a few years, and Rooted has been downloaded almost 2 million times all over the globe. This is primarily organically, meaning users download Rooted, have a great experience, choose to leave a review, and share it with their doctor, family, friend, or community member. Some of our top referrers are doctors, and we have over 30,000 reviews from people sharing how much Rooted has contributed positively to their life. We have a 4.8 global rating, and we are really just getting started. Some of our superpowers are our focus on panic attacks as opposed to only general anxiety and general mindfulness. A lot of users share that that is just such a huge differentiator for them on their healing journey. We also work very closely with doctors and therapists in order to ensure that Rooted is a symbiotic tool alongside these other important resources. And really think that we are a rising star and the right fit for this award, as we have so much product market fit and user testimonials behind us, really proving that we're in the right place. And we do rank #1 for panic attacks and #2 for anxiety in the US, which is our largest market. So thank you so much for considering us and helping move this mission forward.
Hi, I'm Nicki Tessler, CEO and co-founder of BeMe Health, where we're setting a new direction for teen mental health care. As a mom of 2 teenage daughters myself and a clinical psychologist, I can tell you that the way in which we deliver mental health care today does not resonate with this digital first generation. At BeMe, we built a solution that combines scalable and personalized digital interventions with real-time coaching that equips our teens with tangible skills and democratizes access to clinical care such as therapy and psychiatry, and offers crisis support 24/7 so that we can help all teens become their best and greatest versions of themselves. And we've got lots of superpowers. We have a team like none before, with deep domain expertise in behavioral health, coupled with engagement brainiacs from Facebook and Disney, and child technology advocates that make safe by design their highest priority, so that we can give teens something that they like and need, and finally crack the code on the appeal game for this generation. And in terms of why we should win, well, we launched this product in January of 2022 and already have over 25,000 in monthly active users. And we've made considerable impact by reducing depressive and anxious symptomatology in our teens, while also providing increase in psychological targets of hope and self-awareness, so that our teens are not just enduring, but they're actually flourishing. I can't think of something more deserving or some problem more worthy to solve than the teen mental health crisis. Thank you so much.
Hi, I'm Dr. Bashar Saab. I started Mobio Interactive when I was a principal investigator at the Zurich Psychiatric Hospital. Our digital health solution is an all-in-one platform currently in use by hospitals and telehealth providers in North America and Asia for remote patient monitoring, as well as patient and clinical decision support. This platform can reconfigure following prescription to unlock an exciting pipeline of interventions for various CNS disorders. 4 of these interventions are already clinically validated, and 1 soon to be accepted by the FDA for full market clearance. Our superpower is the ability to objectively quantify stress. Objectively quantify stress without using a wearable, using only a 30-second selfie video, and doing this with more accuracy than any other organization today. We leverage this superpower in order to understand the efficacy of various treatments for each individual patient, and we can then personalize therapy for what is most clinically meaningful for every single patient. This is the beginning of precision psychiatry at scale. We believe that we should win the Digital Health Award because of our commitment to tackling what are truly the hardest problems in all of mental health care. This is the establishment of clinically validated treatments that can be scaled to meet the demand, the size of the global mental health care crisis, as well as a strong measuring stick that provides objective data about brain states in order to understand what therapies are working and to ensure that the right therapy gets to each patient as quickly as possible. We're very excited to be part of this competition, and we're looking for partners all over the world to help scale this vital technology, our unique technology, to patients all over the world that need it. Thank you.
Ellipsis Health has created the only clinically validated vital sign for mental health. By harnessing the unique power of the human voice as a biomarker for mental health and artificial intelligence, we generate a clinical-grade assessment of the severity of anxiety and depression. This creates an objective, personalized, and scalable clinical decision support tool. Now, through this innovation, we can identify and monitor people in need and connect them to personalized care. So what's our superpower? It's our science. We are committed to leading the industry in clinical and speech technology research, establishing best practices, and contributing to the impact of voice as a biomarker for mental health. With 7 published papers in top peer-reviewed journals, we employ the latest deep learning architectures for both natural language processing and acoustics. In contrast to approaches that rely on feature design, our cutting-edge machine learning methodologies yield superior performance, robustness, and scalability. Our models are also speaker independent. No baseline is required, and they are trained on diverse data sets. We don't need to store any data for our models to optimally perform, maintaining both data privacy and security. So why should we win? Well, over 30% of the population and 50% of those 18 to 29 are struggling with mental health disorders. We are facing an epidemic impacting the well-being of society. Despite the enormous need for mental health care and a growing shortage of care professionals, we are relying on scalable and outdated assessment tools. There has been no vital sign to screen for depression and anxiety until now. Partnering with payers, providers, employers, and digital health companies, we are positively impacting the quality of care, shortening the time to diagnosis, driving workflow efficiencies, reducing costs, and improving patient outcomes. At Ellipsis Health, we are connecting the dots to a happier and healthier future.
Hey, you made it. Welcome to GridX, your companion in becoming your best self. Whether you're looking to find balance, improve relationships, or just get to know yourself better, GridX is here for you.
Confide in the emotionally intelligent GridX bot anytime. Like a trusted friend, the bot will always be there for you, offering advice, perspective, and compassionate solutions. Anything you say will stay between you and the bot. GridX offers mindfulness tips like breathing exercises, journaling exercises, and even physical exercises.
If you're faced with a tough decision or don't know how you feel, our self-interview can help you discover wisdom and strength you don't even realize you have. We created Grid Expeditions to help you cope with big experiences like anxiety, trauma, and grief. These curated journeys give you the insights, tools, and skills to help you heal and grow.
Browse through our wide-ranging library of tools, tips, and techniques. Save your favorites in your backpack. Wherever you are on your journey of self-discovery, GridX can help you embrace the good times, navigate the bad, and develop grit along the way. Remember, we got this together.